Welcome to the Birth Neoterist space with your host, Sabia Wade. And today we're going to be talking about pelvic health, pelvic floor health, and I'm very excited. I also want to preface the conversation that we'll be talking about it specifically to people that identify as women, just because that's usually the crowd that Lynn works with. So we're going to keep it there because I feel like, there's also complexities when you get outside of that crowd. So we're not going to be talking about that today, but I do think that it's still going to be helpful to everyone who has a pelvic floor. But to begin our conversation, Lynn, do you want to introduce yourself?
Sure. So I'm Lynn Schulte. I am a pelvic health physical therapist. I've been a PT for over 30 years. I founded the Institute for Birth Healing back in 2016 after specifically working almost exclusively with pregnant and postpartum women and discovering all these patterns that I found in the postpartum body and realizing that the pelvis doesn't always go back to its original position after birth. And so I found that I'm coining this as the open birthing pattern. So I discovered that the pelvis stays in this open birthing pattern, and it really has a lot of detrimental effects on our postpartum clients and their healing. And I've learned how to change these patterns. And, my clients were getting off the table feeling better in their bodies in one session. And so I knew I had something special that I needed to get out into the world. And so that's when I created the Institute for Birth Healing to help teach other body workers how to more effectively work with this postpartum population. And so I have the Institute for Birth Healing as my online platform. And I also have my clinical platform, which is the Center for Birth Healing, where I see clients one-on-one in Denver and the Boulder, Colorado area.
Yes, and I have been one of those clients. So we'll get into that. We'll get into it. So first, can you explain to us so one of the things, okay, so background, right? Because we're gonna be mixing this with personal storytelling and expertise. So for me, my long drawn out story, but making it very much shorter, is back in 2015, I was having a lot of back pain, a lot of weird rib pain. Went to my doctor. I mean, I write about it in my book. I went to two white doctors who were like, it's just your kidney. It's just this. It was all this stupid shit. And then, and they're going to find out I went to a person of color who was like, no. So I went to get, ultrasound or whatever the hell I got, and a CAT scan, I think it was. I don't know. But anyway, I had a big ass fibroid, right? So boom, had the fibroid, had to get open abdominal surgery to get it removed because it was too big for it to come out any other kind of way. It was hitting my spine, it was hitting all the things, it was hitting my bladder. It was a mess. And then, so I did that. So after my surgery, they were like, oh, it's gonna be all good. You're gonna feel so much better. This was not getting better. This was not getting better. The first month, when I got impacted because I couldn't poop because of my fibroid. So it was like a week after I was in the ER screaming in pain. Then 2 weeks later after that, 2 or 3 weeks later after that, I'm still in my first month of healing. I bled out because my uterus was like, contract. We don't contract. We're going to just bleed out at one time. So I was passing out on the floor. It was a mess, right? And then after that, so then after that, they were like, okay, you're going to start getting better now. And I didn't. I was in extreme pain. Everything was hurting. Everything was just terrible. I was in a hospital every month on my period. It would just be terrible. Then at the end of that year, I ended up getting another surgery because my bowel had attached to my uterus. Mm-hmm. And I also had scar tissue on my bladder. It was just a mess, right? Got an IUD. It's a fucking mess. So anyway, after that, obviously still was having a lot of pain. Sex was not thinking about that. Not even thinking about sex. What is sex? Don't want to do that. Don't want to think about that. And I think it's and we'll talk about this in your work, which I think is so special because you do this piece of really relating every other piece of life to what's happening here. It's not just oh, you had a surgery. That's you're what happened in childhood and what are these things that are happening and what's happening with your safety and it's all these things. Okay, but anyway, I'm excited. That's why I'm talking so fast. So then someone started telling me I was maybe a year and a half out of my surgery, still having I moved to San Diego at this point. I was still having a lot of pain, right? Pain when I'm on my period, pain when I'm not on my period, just a mess, So then someone started telling me about when I had to go to a urogynecologist. They're like, you should go to a urogynecologist because now basically urogynecology is you got a complex situation. Okay. this is not going to be easy peasy lemon squeezy. Like, you need to go somewhere special. So cool, went to them, and then I got tested for vulvodynia, and they did the Q-tip test, and they were like, here's a Q-tip out here, here's a Q-tip on the opening of your vagina, and I was like, ah, like it was terrible. So they're like, that's one thing. Then we started talking about like, I have like piriformis syndrome and pelvic, like chronic pelvic floor pain, like all these muscles and things, and all things you work with. So
Yep.
then someone was like, you should go to pelvic floor therapy. And I was like, what are you talking about? I was like, I'm like, what?
Right.
Where does that even happen? Like, am I going to a massage clinic? Like, what and
Right.
what does that mean? Like, are you going to massage my butt cheeks? Like, what does that actually mean? And that's when I got introduced to my first pelvic floor therapist. Went to a physical therapy office. Obviously, went into a private room. Had my first appointment, and she was like, "Yeah, so let's check the alignment of these things. Let's, all these like assessment things." And then she was like, I remember she was like, we can do a internal exam today if you want, obviously, but like we don't have to. And I was like, internal? Like you're gonna go in there and like you're gonna do things? Like this is physical therapy? Because it was just like, and I had been to a physical therapist
Yeah.
before for my knees. So I'm like, wait, hold on. And then like long story less long, like I started going to her and it was like I remember like she started doing the internal exams and like I would walk out and I'm like, oh, my hips are in alignment. Like my pelvic floor, I can tell that there's a difference and I can breathe. Like I can like my pain is reduced. Like it was just night and fucking day. Even in those like one-time experiences of just being like, let me stretch out the things in here. Let me show you like how your pelvic floor, because I have a hypertonic pelvic floor, meaning that my pelvic floor is tight. And it's just like loosening up physically. I'm like, what? So anyway, I said that all to say, right? Like say that all to say, like, can you explain what you do to the common person like myself, who a lot of us, even in birth work, have never heard about pelvic floor therapy?
So first thing I want people to realize is that intravaginally, there are muscles in there. So that's why we might want to do some intravaginal work. And the other thing I want people to realize is that, from your pubic bone to your tailbone, in that perineal area, we have 3 different experts if you go to a doctor. You have a urologist for your bladder, you have a gynecologist for your vagina and your uterus, and then you have a proctologist for your rectum. And unless those doctors have gotten specific training and understanding on the pelvic floor muscles, not one of them may understand that the symptoms or issues that you might be dealing with in their specialized area may be caused by pelvic floor muscles. And so as physical therapists, and especially myself, so I'm a pelvic health physical therapist. So I work specifically from, I hate to delineate, well, I work from the belly button down to the pelvic floor. But, that is my area of expertise. I do address a whole body when I'm working with someone, but as far as my area of expertise, it really is from the belly button or, from really the core. So the diaphragm to the pelvic floor diaphragm. And we need to know that those muscles can cause all sorts of problems in there. And the experience that Sabia went through is I'm a pelvic health physical therapist that works with the organs of the pelvis. So I know how to manipulate and mobilize the organs of the bladder, the uterus, the bowel, and not all pelvic health physical therapists do. And so there is a delineation. When I train my body workers that can do intravaginal work, they learn how to work with the bladder and the uterus and the pelvic floor muscles intravaginally. We can also work with the bladder and the uterus externally as well. And what I have discovered over the years of working with all the thousands of clients that I have is that when we have tight pelvic floor muscles, that they are really at the effect of the bladder and the uterus. So if the bladder and the uterus are not happy, the pelvic floor muscles have increased tone in them. And so as Sabia was sharing her story, in my head, I'm going, well, of course you had pain, and of course you had bowel problems, and of course you had, sensitivity at the labia, because there's structures in the pelvis that are so important for the overall health of the pelvic system. Okay, so there's, one of the main things that I always work with my clients is the uterosacral ligament. Okay, so
Yes, I remember that when you were doing the session with me, because you were doing something, you were like the fluid, and I was like, oh, the fluid is moving. So you're moving my uterus around. I remember all that. Okay, go ahead.
Yeah, well, we need to understand that the cervix, which should sit right in the middle of our pelvic, the pelvic canal. Okay, so the vaginal canal, the cervix should sit right in the middle of it. But after birth, I can find it everywhere in the pelvis. I just worked on someone this week, and the cervix was poking into her bladder. And I was just like, and so I'm just like, oh, your cervix is really close to your bladder. And at the same time as I said, do you have to pee a lot? She was thinking, I wonder if that's why I have to pee a lot.
Yes.
So, yes, when the cervix is poking into the bladder, yes, that makes you feel like you always have to go to the bathroom and pee. And so the cervix in there should have the mobility of a piñata. Okay, so it should be able to swing all around and move all around 360 degrees. Okay, but we do have ligaments that help hold it in its proper place. But those ligaments should be loose enough that that cervix is like piñata. Because think about, if we have a cervix that's really restricted and tight, and then we try to have intercourse, that all those structures need to be able to mobilize up and down for intercourse to feel comfortable. Okay. And if it can't, and it's stuck, and tight ligaments can cause restriction, scar tissue can cause restriction of those organs from being able to move properly, whether it's a cesarean scar, or you having a fibroid removed, or a laparoscopic, or an appendectomy, like any lower abdominal surgery will create scar tissue in there. And I like to teach that when the bladder is happy, and the uterus and the cervix are happy, then your pelvic floor muscles can be happy. But if the bladder is restricted, and after a baby exits vaginally, or even if it comes out cesarean, if it tried to come out vaginally, it gets impacted by that baby's passage. And so it can really smush the bladder off to one side or the other. I find it tends to go off to the left more than the right. But the bladder can get pushed off to the left. The cervix, like I said, can be anywhere in there. So it can be off to the left, right, back, forward. And those ligaments, that uterosacral ligament, so a ligament that attaches from the back of the uterus to somewhere in the pelvis, so sacrum, or it could be some of the ligaments back there. That ligament has a plexus of nerves that runs through it. The inferior hypogastric plexus is a bundle of nerves that run right through the middle of that uterosacral ligament, which those nerves innervate all of the tissue in that vaginal space. So it innervates the bladder, it innervates your labia, it innervates that vaginal tissue. So I find that when I go to do intravaginal work, and the tissue's painful or tender, when I release that uterosacral ligament, that tenderness goes away. And
it's wild.
It is, isn't it? That's why
I remember you did my session, you moved my uterus. I think my uterus is going like maybe to the right, because I know I have scar tissue on one of my sides, because that's where a bunch of my scar tissue had built up. And I remember you had moved my uterus to one of the directions. You made it more mobile. And you're just like casually moving it around, like, yeah, we're gonna move this around. And you're like, see how it's moving more? I'm like, yeah, it is moving more, right? But I remember like my next period, because I don't get periods like that because I have like an IUD, but I get a lot of like, my pain is still my pain, like regardless. But I was like, it's just not as painful. And I remember being like, is this like me thinking this, or does this actually happen? But then like the next couple of months, it still wasn't that same pain. And I was like, Huh. Okay. But also like one of the things that I wanted to talk about is like, I think when we talk about pelvic floor health, I think a lot of people, one, think that like, for example, like there's a difference between like something being normal and something being like normalized and it being actually being okay. Like I think a lot of people think like you have a baby and then you just this is just what happens, right?
Yeah.
Or you have a fibroid or you have some type of like complexity in that area and this is just what happens. You have pain now, or you have, you pee a lot, or you have, incontinence, or you have like, or sex is now painful, or now like they think like these things are normal, or maybe they are normal, but they're not right.
Well,
But
they're common. They're common,
they're
but they're
common. That's the word I'm looking for.
yeah, they're
Mhm.
common, but they're not normal. And what we all need to understand is that doctors are great. They can totally keep you alive, and they understand disease. Okay. They do not understand dysfunction or movement. Okay, so the tissues of our body need to have mobility. As we bend and twist and move our body, our organs have to be able to slide and glide to allow that movement to happen. Okay, our uterus expands 10 to 15% every period. It gets larger by 10 to 15%, and then it shrinks back down. Our bowel fills up and it empties. Our bladder fills up and empties. And so when a doctor goes to look at you, especially after birth, they're going to look at you and go, everything's healed. Everything looks normal. But what they're not assessing is the mobility of those tissues. Can those tissues expand and contract? Can
Mhm.
they hold more urine? Can they not? And they truly, not most doctors truly don't understand scar tissue and the impact scar tissue has on that motion and that mobility of our tissues. So your whole thing, you had scar tissue in there and it's locking everything down. Like scar tissue is like hitting a brick wall. When we
Yeah.
have a cesarean birth, they cut through our lower abdomen, they cut through the abdominal walls. There's 7 layers that they go through. They cut into the uterus to get the baby out. Now they sew all that up. And scar tissue forms very haphazardly in order to
Mhm.
heal the tissue. So it is very unorganized tissue in helping to heal things. And it attaches into everything. Like you said, it attached into your bowel. And we need to help tissue to learn, we need that scar tissue to learn how to lay down properly. Now, if you have a scar on your arm and you can bend and straighten your arm, that scar tissue learns how to lay down in that organized manner of movement based on the
Mhm.
stresses put on that scar tissue. Well, down in our lower abdomen, there is no, like that area doesn't move much, right?
Yeah. Mhm.
So that scar tissue just kind of glues everything together. And doctors don't know what to do with that. They're not assessing the movement of the tissues. And that's what physical therapists can do. That's our
And
job.
scar tissue is so like when I had my first surgery, I had to open abdominal the first one. The second one, so the first one I ended up having a lot of pain during like as I was healing, right?
Mhm.
Which makes sense, the scar tissue was building up, right? So like as I was healing, as I was supposed to be getting better, I was getting more pain. Cause
Yeah,
like when my period, what happened in that expansion, what happened in my uterus, everything was like, we're pulling, we're pushing,
yeah,
we're
yeah,
fighting for our lives. We
yeah.
right. And so I'd be in like terrible, like hospitalized me pain, right?
Your
And then I
uterus
had
does not expand. Your uterus
exactly.
does not expand.
And then I could tell, like, I could tell where like where what I'm like, it's here, like right
Uh-huh.
here, it's pulling, I don't know what's happening, but something's happening right here in this section. Um, and then I had a laparoscopic surgery, right? Because they're like, okay, well,
Yes.
scarring is your thing, obviously. You scar it really quickly. So like we're going laparoscopic, but also like that doesn't diminish that there's still gonna be some scar tissue that happens. There's still gonna be, a rebuilding of the body. And I also like one of the other parts that I think is really important to talk about in your work is like, yes, there's all these physical aspects, right? But I think when people, whether they're giving birth or whatever the process or procedure they're going through, when you start to move through that type of pain, you also become very traumatized
Yes.
by like, can I trust my body? Can I now, like, I'm fearing if my period starts. Now I'm fearing like, am I going to be in public? Am I going to have to go to the hospital? Like, am I gonna like, can I enjoy pleasure anymore because it hurts? Like, there's also like these other things that also then I feel like creates, especially for me, it's like I said, I have a hypertonic pelvic floor, so that's like super tight, but it adds more tightness to it because now I'm just anxious about it.
Right,
Right.
right.
And if
Yeah,
you're also someone who has anxiety, which I have anxiety in general, right? All that stuff lives in your pelvic floor. So it's like, it's not just like what's happening in the sense of like your surgical procedures or birth or whatever, but it's also your mental health that also has a direct correlation to the wellness of your pelvic floor.
absolutely. Absolutely. And so I say the pelvic floor is kind of like the sponges of our emotion. And so all that fear you were talking about, the pelvic floor muscles are our sense of safety and security in the world. Okay, so if we're not feeling safe and secure, or if you've been abused in any way, whether it is sexually, emotionally, verbally, think about what animals do. A dog does, it tucks its tail under between its legs when it's,
Mhm,
right? We do
mhm.
the same thing with our tailbones and by tightening our pelvic floor muscles. And so that emotion can get stuck in the tissues. And what I find there are, Sabia, you are an excellent scar producer, which is not a good thing. Um,
Yeah.
Fortunately, right?
My body's like, scar, let's go.
Sure, boom, let's do it. We do it well. And then
Mhm,
there's those that hardly create any scarring. So there is that continuum of production of scar tissue. However, I also find that the state of the event that creates the scar can impact the scar. So I've worked
mhm.
with a client who this was probably 6-7 years ago. Back then she had a vertical C-section scar, which is unheard of, right? You
Yeah.
rarely see a vertical one. And right by her belly button, the scar tissue was as thick as my thumb, but only for like an inch section. And it was really tender for her. And so I just helped her tune into that area, and we both sensed into it. And she got angry at the surgeon. So I sensed into it, and I could really feel the anger being held in that tissue. And she noticed that as well. And so we helped her process that anger towards him. And when we resolved it, that scar tissue was as thick as my little finger. So the scar
Mhm,
tissue had diminished in half just by processing the emotion that was held in that scar tissue. And so one thing that I'm very, very careful of, because I've just dealt with it so much on my clients, is making sure that the surgeon is in a good mood when he does your surgery. Because any frustration that the surgeon, like I worked with a gal who had a knee surgery and her knee was so messed up. And when I tuned into the knee, I could just feel the surgeon's energy in the surgery.
mhm,
And she said,
mhm.
"Oh, my surgeon was frustrated. He was running late and he was trying to get out of town to go out on vacation." So all that frustration was locked in the tissues of her knee. And so we need to understand that trauma, that whatever is happening to us, surgery is trauma. Surgery is a traumatic
Mhm.
event to the body. And whatever our state, like, especially think about emergency cesareans, that mom,
Yeah, and
right?
it's just a bunch of trauma that goes into that, like, even
Right.
for the surgeon, obviously, is that, like, their regular job, but it's an emergency, it's
Yeah. So
still a lot.
we need to honor that, right? We need to
Mhm,
honor and acknowledge that the amount of trauma that is there. And I always like to say, when I'm working with trauma, I want to befriend it. I want to help the person understand that this response in the body, a lot of times when we're traumatized, the body, when we're in that protective response, we can either fight, flight, or freeze. and
mhm.
and there's total collapse. But the fight and flight, when we're in surgery or when we're in labor, we can't run from it and we can't fight it. So the freeze response is the most common response in the body. And that's, the pelvic floor muscles tighten up. That's the whole pelvis feels like it's holding its breath. So
Yes. I mean,
there,
for me, like, I can literally, like, when I'm having, like, moments of whatever, especially as, like, of course, the work that I'm in is very, like, you know, just fighting for human rights, you know? So,
yes,
like, So like a lot of that is like held, right? And like a lot of my practice is me being like, wait, release my pelvic floor. A lot
Yeah.
of it is like, well, you know what's so funny? Okay, two things. When you're talking about the surgery thing, like the surgeon. So I had breast reduction surgery like 2 years ago. Actually, when I had came to Colorado, I met you, I was like maybe like a few months out of my breast reduction surgery.
Uh-huh.
And one of my fears was like scarring, right? Because like I know that my body is a big scar type of situation. But like in actuality, like at first when I first came out of surgery a couple months, I had like some scarring, some keloids, whatever. But they really have softened up. And I really feel like a part of that is because like one, my surgeon is like, first of all, he loves breast reductions. Like that's like his love. And like even when I first met him, I could feel the energy of like, oh, you want to do this. Like you
Yeah.
want to like be helpful to me. Like you understand like what I'm going through here. Like
Yeah.
and
Yeah.
like during the whole time, like he always had like a good energy about him. And I also feel like that helped me in my healing process. And not
Absolutely.
just like the physical,
100%.
but the mental healing around it.
Yeah.
Because I've had surgeries. And so surgeries can be really traumatic for me, just in a sense of like, here we go again, going under anesthesia, like, like when you're someone who has chronic like health issues. So that
Yeah.
was one thing. So I was like really appreciative of that like surgery scar thing. Cause I'm like, that's something to think about. And then the second thing, which I think is like funny. So me and my partner went to not Florida, we went to Puerto Rico like a month and a half ago or something. I don't know. And so like we talked about pelvic floor stuff. She's actually had two fibroid surgeries and all that kind of stuff. You're gonna have to meet her and do a session because
Okay.
okay.
Yes.
But but the other thing also, like, so we were in Puerto Rico, like I told her about my pelvic floor stuff. And so we were talking about that. And I was like, you know what? Why don't you just do like a little exam on my pelvic floor so I can show you what I'm talking about? And like to me, like that was really important because I also like, of course, obviously we're like sexually connected, but it's more so like I really want you to understand what I mean, if that makes sense. Like when I say like I'm stressed out, or if I say like I have to opt out of certain things, or I say like whatever, like I want you to actually know what I mean. So she did an exam. We're in Puerto Rico, where like the windows open, you can see the ocean because we're right like on the beachfront. And I
Uh-huh.
like have my legs open, and she's like, okay. So we get we get some lube or whatever. And she like starts the exam, and she was like, okay. So she filled in both sides, and she was like, one, okay, I can see this is like more of your like harder side. This side is more spongy over here. This side is more, and I was like, yeah, that's my side that I struggle with. And I was like, you can even see it like when I do like my hip openers, like my right hip is always a higher one. And I
Yep.
was like, that's where my like, pelvic floor is like it's harder to like move through. And it's usually where more of the internal exam is like really helpful for me is on that side. But anyway, we had like a whole like discovery session. And she was like, oh wow, like I can really feel the difference. And now even like on my external, like the other day she's giving me a butt massage. And she was like, your ass is hard as hell. And I
Mhm.
was
Yeah.
like,
Yeah.
right. But I also feel like that, like, for me anyway, especially being someone who wears their emotions in their pelvic floor, like that's part of creating safety is being like, let me show you. And also like, at least for me, and I can't speak for everyone, but especially when you're in a sexual relationship with someone, it can be so much pressure to perform. And I hear this from like clients and stuff too, like that, like I gotta snap back and I gotta get back to having sex and I gotta, perform the way that I used to, and I gotta be able to do all the positions and I gotta be able to do all this. Like sometimes that part is so anxiety provoking
Yeah.
because you're like, I need you to like look at my vagina as not just a sexual tool and look at it as like a part of my well-being, a part of my health. So I'm just saying like that session with her was like helpful for my mental health
Yeah.
because I
So
was like, you know what I mean? Does that make
yeah,
sense?
absolutely. And there's two things that I want to unpack with
Mhm.
everything that you just said there. And one is that um, you brought your partner in to help explore so that she could become more aware of what you're dealing with, right?
Mhm.
Wouldn't it be wonderful if all women could bring their partner in? But I think in order to do that, we have to be comfortable with ourselves. So I would
Mhm.
encourage everyone listening to this interview, have you ever explored your vaginal opening? Have you ever
Mm-hmm.
inserted a finger into your vaginal space and felt and understood where your muscles are, what the urethra feels like, you know? So if
Mm-hmm.
I could just quickly, like, so think about your vaginal opening as a clock, and at 12 o'clock is where the urethra is. So if you just put your finger in yourself with your thumb up right at 12 o'clock, you're going to feel this like tube. That's your urethra. And if you follow that backwards, you're going to hit spongy tissue, and that's your bladder. And if you poke on it, you might like, oh, I gotta pee, right? So if you turn your finger down at 6 o'clock, and so I like to assess the muscles. I like to use my thumb because it's
For
easier
sure.
access, right? So if you place your thumb right at the bottom at 6 o'clock, that's called your perineal body. And if you insert your finger in a little bit, you'll be right on your bowel. And so then you might get this feeling like, oh, do I have to poo, you know? But
And that's when your pelvic floor therapist tells you if you're constipated or
right, yes, yeah, but we don't mind that. That's all part of
not.
the normal territory, a landscape of this area. But if you come off to one side and you press your finger down, so kind of think about laterally and inferiorly, so out to the side and towards the floor. Um,
Mm-hmm.
those are where your muscles are, and they should, like Labia said, they should spring and bounce like a trampoline. And the one side should be the same as the other. So when you press on it, it gives, and then it rebounds and comes back up when you release that pressure. That is a normal tone pelvic floor muscle. And if it's cardboard or hard like a brick, that's a muscle that needs attention. And one of the things that you can do is just kind of put your finger on that hardened muscle and breathe down into it and see if you can't get it to relax. Can you consciously just kind of help that muscle to let go and relax? We all have core holding patterns in our body. So the right side of our body is more masculine. It represents our masculine. The left side is more the feminine. And so there's different parts of the pelvis. Tammy Lynn Kent does a beautiful job of describing it all in her book, Wild Feminine. So you guys can get that. That's a resource. And she walks you through the pelvic map and really mapping out what the internal landscape of your vagina is like for you. And so I encourage all my practitioners to do that to themselves, because it's
For sure.
us as practitioners to be comfortable, describing it to our clients and encouraging our clients to do it. Hey, look, I did it. It wasn't that big of a deal, blah, blah, blah. So,
And of course, my right side of my body is my more masculine side, and also I lean into my masculine a lot in my workspaces. But like with my partner, I'm like soft as a dandelion. So like, so like I think that's also the balance, like bringing her in because she brings more feminine to me, so I feel
yeah,
more safe because I feel more
yeah,
balanced.
she
I
holds
think,
your feminine for you. She helps allow
yeah.
access it more for you. And that's
But I
beautiful.
think like I think it's just like so important, like, and that like, obviously examining yourself. And I think too, like, at least for me, I can't say for everybody, but I also would suggest like being able to like, I think sometimes for people who have vaginas, you're so sexualized all the time, even by your partner. Whereas like you feel like, oh, you can't see my vagina unless it's for sex purposes, or I can't be like naked in front of you unless I'm trying to invite you to do that. And I think it's so important, especially for people who have anxiety, who have different like histories and traumas and PTSD or whatever it is, like to be able to be around people where you're not always going to be sexualized, but you can be in your body and you can show your body and you can be like, hey, this is what's going on over here. Like, I think that part creates so much safety for me that
Absolutely.
my pelvic floor
Explore
is like,
together.
oh,
Yeah. Explore this area together. Like help
hmm
the partner to understand, because I don't think a lot of partners, if especially if they're the male species,
hmm hmm
they don't, I mean, they may know what area to stimulate for you,
yeah.
but they don't,
But do they always know that from what I hear?
not always,
They
no.
don't always know that either.
No, not always. So that's where if you can explore not only the muscles, but what does cause better stimulation for you. Like let's. I think for women, we need to own this area. We need to get rid of the collective consciousness of down there, and not wanting to explore and invite this to be a integral part of our being, and really get to know it ourselves. Like until we know it and own it ourselves, we can't expect our partner to have any sort of respect or, knowledge. And I think there's a lot of shame that we carry in general.
For sure.
So we need to, the best way to deal with shame is by honoring. So if you have shame in this area, how can you best honor this area? Honor
For
it by
sure.
know it. Honor it
For
by
sure.
understanding this tissue better
Yeah.
for
And
you.
like dropping, like, especially when it comes, I mean, obviously we can have a whole conversation on sexual health, right? But
Yeah.
like I think one of the things that like has been so helpful for me in pelvic floor health is like, and just like my experience is one, like understanding, right? Which is why I could tell my partner, like, hey, go in, do this, move over here, right? Like
Yes.
that's
Yeah.
from like that experience. And also like pelvic floor therapists have always um given space, because we like when she goes to get pelvic floor, you talk about sex, you talk about like, I mean, we get up close and personal, right? So like
Yes.
my pelvic floor therapist that I have at home, she'll be like, especially for me when it comes to penetration and stuff, like from pelvic floor therapy, I learned how to get the dilators and be like, hey, what feels comfortable for you? Like just learn this space. It don't have to be, the aim doesn't have to be to have an orgasm. The aim doesn't have to be like climbing the walls. It's just like learn yourself. Like,
Yes. Yes.
and then also like set goals for yourself, right? Because I also think, especially for people that have penetrative sex, it's like, there's like these goals that are like monstrous in size. And it's like, does that have to be or like
Right. No.
right? Like penetrative sex can be a small dilation thing for you and a bigger, like it's just like so much that I've learned that has allowed me to like take pressure off
Oh,
of myself and also to not be, like you said, not to hold shame over how I want to interact or when I want to interact or, I mean, I feel like that's been like, I know that y'all are not like mental health therapists, but in a lot of ways, it's so connected to mental health that it's therapeutic in that way
yeah. Yeah. It
to
really,
be with somebody and be able to ask questions and be like, is this okay? Like, because sometimes you don't have anybody else to ask that to.
right. Right. And I just want to put this out there that not all pelvic health therapists are the same. Just as
That's a fact.
chiropractors are the same or all doctors are not the same. Okay. And so I would encourage anyone who is experiencing and dealing with any issues in this area. I have a list on my website of a directory of clients that of practitioners who I have trained. And I train in a very respectful manner. Like one of my number one rules in working with the body is to respect the tissues. And so in that respect, we don't create pain. And I know not all pelvic floor therapists
Mm-hmm.
do that. And so
Yeah.
my goal is
It
to,
is, it should be a good experience just for people who are like
yes,
moving through it.
yeah,
Like I go to pelvic floor therapy very happy. I'm like, let's go. What we doing?
yeah,
Like you want
yeah,
to internal, you want to external, you want to,
right.
and
Yeah,
also like naming that, like I know like one of the challenges that I had one time, like, cause during when I do bleed like out, that could be like a really painful time for me.
mhm,
But that's also one of the best times to go to my pelvic floor therapist, right? And like you kind of like try to shut down because like I'm in a lot of pain, I don't want whatever. But like if you have the right pelvic therapist for you, they can help you move through those painful times even better.
absolutely. And there's a great resource on YouTube, and I hopefully can maybe get you the link to put in the show notes, but
Mhm.
Dee Hartman with two N's. She has a video on there how to do intravaginal work without creating pain. So there's like 5 exercises someone can do. And this is perfect for someone who wants to do and have, if penetration is painful, you can do
Mhm.
5 things to decrease the amount of pain that you have for penetration. So I
Mhm.
highly recommend that as a resource if anyone is dealing with painful penetration. You can do these 5 things. One is, just breathing and helping to calm down that nervous system. And then there's 4 other things that she talks about that can help decrease your pain levels. So know that, not all pelvic floor therapists are the same, but those that are on my website are going to have learned a protocol that makes doing intravaginal work more respectful and less painful for you. The other thing I want to just throw out there is that if your pelvic floor therapist is not addressing the bones of your pelvis prior to doing intravaginal work, they are missing half of the puzzle. And unfortunately, a large majority of the pelvic floor therapists are not trained in how to work with the bones. And so these are all things that I'm trying to change. I'm doing my best to get
Mm-hmm.
this education out there so that pelvic floor therapists are better. They're better at
Yeah, yeah.
getting results and doing things in
And
a
also for people who
right.
are like, I don't know about someone doing internal, you don't have to do internal coming into pelvic floor therapy. Like
Exactly.
that, it's always an option. I've
Yes.
always had pelvic therapists who are like, hey, we can do external. If you're open to internal, if you want to try it, we can do it. Like, so it's not a thing that you have to go in there, open your legs. You literally can stay closed. They can do like an exam on the external, help you do some things on that process and move move you into internal if you want that eventually.
Yeah.
But what I will say is when you get comfortable and you find the right one, you're like, let's go. You
Yeah.
ready?
It's
I'm taking my pants down fast. I'm okay. Let me take my pants off. Let me get on the table. When we start my stretches before we okay.
it's very, very powerful work. And that's why it does take that the therapist needs to have that respect for this area and the tissues and not creating pain to, and so there's sometimes I always listen to the body. So there are some people that I don't do intravaginal work until their body says yes. So, Sabi,
Mhm.
you may come into me and like, yeah, let's go, girl. But I'm going to listen to your body. And if your body's saying hell no, I listen to your body.
For
Because
sure.
if the body and the mind are not on board and your mind's saying, okay, yeah, I'll do this, but your body's like, hell no, you're going to cause trauma.
For
And
sure. I had one of my doctors, who's now my friend, we like fired each other to be friends. But like Dr. Lessex Ford, she's in the Atlanta area. She's been named like one of the top urogynecologists. And I remember I went to her like when I didn't know her, of course. And I was like, telling her all my, history or whatever. And she's like, okay, well, let's do like an internal exam. And like she was a good gynecologist. Like it wasn't like get naked. It was like, let's have a conversation. I was comfortable. I was like, okay, cool. I like this doctor. And then we went to do an internal exam and she went to put the
speculum.
speculum, right? And she like tried to enter, she was like, no, we're not doing this. She was like, let's go to public floor therapy.
Yes.
Like 2.5 years ago, she was like, no, she was like, your body's already pushing back. I haven't even done anything. Like, I'm not about to force anything. I'm not going to do that to you or to myself. Let's just
Oh, that's
go
beautiful.
our way.
Yeah.
Right.
And for those listening in, pelvic floor therapists do not use speculums.
Mm-hmm. No
Okay.
speculums
Yeah,
around at
just
all.
use a gloved finger
Mm-hmm.
a gloved finger is what we work with those tissues with. Okay. So, just know that. And like
Yeah.
I
Because the
said,
speculum in itself can bring on like,
oh, absolutely. That's stretching the tissue. And if that tissue like yours did not want to be stretched open and doctors force through that, that's creating more trauma in the body. So good for her for knowing
yeah, no, she's like so bomb. Love her. Love her.
that.
That's why we're
Yeah.
friends now. But I have two quick questions for her. I know it's kind of we're gonna try to make it quick, right? Because we have a few more minutes. So my first question is, when we think about the future of pelvic health, I think one of the things that can be obviously a barrier is access. Health insurance doesn't cover it all the time. Even when they do, they don't pay y'all enough for it to make sense. Like it's
Yeah.
all these things. So I'd love to hear like what you envision for the future of pelvic health, especially when it comes to access.
Yeah. Well, I think that there is a lot that we can do for ourselves when it comes to pelvic health. And I would say Tammy Lynn Kent's Wild Feminine is one of the greatest resources for us as, for anyone with a
Hmm.
vagina, um,
Hmm.
to really get to know and understand that work and know that we are, I want more people to feel empowered in their bodies and accessing this pelvic space and understanding it at a deeper level is empowering.
Hmm.
It's my goal and my dream to change to train pelvic floor therapists to know how to do this work in a non-painful way. I feel like the basic education that most pelvic floor therapists gets is missing several pieces to the puzzle that can really transform their results and the way that they interact with people. Because I'm just tired of too many clients coming to me and go, oh yeah, that was not a good
That
experience.
was awful.
Yes,
Hmm.
yes. So that,
Hmm.
for me, that's my goal. And I'm super excited to see the amount of change that I have seen in the last 10 years in the growth of pelvic health and the growth of postnatal care. So
Mm-hmm.
I'm excited for that. Knowing that there's more therapists out there doing this work. I just want to get a hold of them so that they can do it in just that next level of care.
For
And
sure.
so the, because it is, unfortunately, it's the newer therapists that are in the systems that will take insurance,
Mm-hmm.
because
Mm-hmm.
insurance doesn't reimburse us enough to make it feasible for us to survive. A lot of pelvic health therapists are going out on our own and doing our own thing, not taking insurance. So,
For sure.
um,
Understandable as a, that mean with doulas and Medicaid, right? Like some people are choosing, they're like, okay, but they also know to work within Medicaid or to work with some insurance companies is taking a decrease on what they actually need to survive. So
yeah.
totally understand that. And I think like there is so much forward thinking on like making this education accessible and like agreeing with you that there's so much that we could be doing for ourselves.
Mhm.
So hopefully there'll be more educational spaces to learn that. Like I think, just learning that as like not as like a an afterthought. I think right now a lot of it is like, oh, now you're experiencing incontinence.
Yeah.
Now let's talk about this. And you're like, why did you tell me about this?
Well, my dream, Sabia, is to start educating the young girls.
Mm-hmm.
Like let's help them to have a stronger relationship with their menstrual cycle. Like let's help them to really understand this area of their body in a
Mm-hmm.
respectful way so that they don't, we're not shunned away from it. We're not a down there culture anymore. It's like this is our power center, everybody. This is our home. That pelvic space is our home and our power center, and we need to stay connected to it. And the more we can
For
stay,
so many reasons outside of sex, right? Like for so many reasons,
absolutely,
like for our
200%.
mental health, for our well-being, for the
Yes,
ability to walk. If you're
yes,
like me, the ability to walk for long periods of time without pain. Like
yes,
there's
yeah.
so many
Well,
things.
yeah, and I'm excited that even there's a issue called endometriosis that creates a ton of pain around your period. It's an extremely painful cycle that women experience, and they, for years it's just been like nobody knew what it was. And so now we have more awareness around this, and so we can really embrace these people.
And what is it called? Adenomyosis.
Yeah, yeah.
You know, that first was like that, like just like my doctor that I'm working with now, because we'll talk about this in my session because we have a session coming up. But like
Okay.
my like doctor is like, you probably have adeno. And I was like, that makes so much sense. Like, like
And do
so
you want
much
to
sense.
explain to people what that is so that they
So from my
understand?
understanding, so I don't have like the best understanding of it, but I know like endometriosis, like it's for your endometrial tissue, like going in places outside of your uterus
So,
and so on and so forth.
and the endometrial cells are the cells inside the uterus that build up to create the period. That's the
Yes, but when they're in other places in your body, it causes
yeah,
complete havoc,
right.
right? And then adeno, from what I'm understanding, is more of like the pelvic floor tissue. How do you explain it? But she
I
explained this to me.
I'm not 100% familiar with this because I just got another term like an endo something that is actually
Yeah.
fallopian tube tissue that comes and goes everywhere. So
Yeah, so from what I understand, we'll get more information on this, right?
yeah,
But it's more
yeah.
so like the tissue in your pelvic floor is more of the issue. And then so obviously when you're on your period and all this stuff is like complete chaos. And also the other part of it is like it's kind of not like like each endometriosis you can get like your the cells removed and try to aim to like get them out of your body or whatever, like out of the place they're not supposed to be. But you're not the only so far the only like real solution to adeno is to have like a hysterectomy.
Mm, yeah.
Yeah, but like I want to get this shit out anyway, but we'll have a conversation
Yeah.
about that.
Yes.
But the last thing, go ahead.
Well, I just want to say, because if you guys all heard that Sabia, I worked with her last year when she came in for PelvicCon here in Denver.
Mm-hmm.
oh, she's coming back this year and she's already got, a schedule, a session with me. And that's truly, if you, Tammy Lynn Kent with her Wild Feminine, and she's got Mothering from the Center and Wild Creative. She's talking about holistic pelvic care. And that is really looking at this pelvic space from a more energetic and soft tissue kind of way. And her, like there's medicine in our bowl. There is information and wisdom for us in our pelvic space. And I would love to do another podcast at some point to talk just about the energetic.
Yeah, because we can get into the generational parts too.
Oh God, that we carry that too. But you were talking about the heaviness of, your work and trying to get this justice and you're carrying all that. Well, our pelvic space is a storage house of all of our unprocessed emotions, traumas, events that we have carried and taken on in our life. And we're carrying other people's stuff because we don't realize that that's not really our responsibility, but yet we hang on to it anyway. And all of that just clouds and gunks up our whole pelvic space. So we don't even know what's ours or what someone else's.
We'll get to that in our session. You know, I'm gonna have all the tea, all the insights. Like, girl, let me tell you how the last year has been.
But that I want, people to understand that there's so much power, there's so much wisdom, there's so much healing that can happen when we reconnect to our pelvic space and we clear out what is not ours and we don't hold on to other stuff and we become more clear of what's ours. And so, Tammy's talking about this should be a well woman's visit to a pelvic health or to a holistic pelvic care provider should be
absolutely
on an annual basis, if not monthly basis, for those
absolutely. Because I just do it. Even though like my doctor is like, okay, you're getting better. I'm like, I'm still coming. This is a part of my maintenance. I'm like, this is just a part of my maintenance to be in this space. And also, if you tell me that my like pelvic floor is back to being a brick, I know I have some shit I need to work through.
Right.
So, because it also it's a flexing, right? Like sometimes you're like, oh, this is good pelvic month, and then other months I'm like, oh, we're like, but it also helps me know like there's things outside of that
that's
that is impacting.
Absolutely. Our pelvis, especially when we look at it energetically, our pelvis is kind of the indicator of how we're showing up in the world and what's going on with us internally. And so understanding those tensions, those tension patterns, those core holding patterns that we have, our pelvis doesn't lie. Our body can't lie. And so when I learned how to read the body and really understand how to work with the body and to read the story that the body's trying to tell me. And I can tell you exactly how you're showing up in the world when I look at your pelvic energy.
You can, because you were like, do you feel safe? I'm like, no, I don't feel safe like 90% of the time. So I feel like I have to be in charge because I don't feel safe. But my last question to close out the space, right? It's like with doing all this work, especially being, tightly intertwined into people's energy, right? And the work that you do, how are you taking care of yourself?
I thank you for asking that because I do pelvic sweeping exercise, and that's one of the exercises in Tammy Lynn's Wild Feminine book. I sweep out my bowl whenever I'm having an interaction with someone that is challenging to me or feels negative. I sweep my bowl. So energetically, I'm constantly releasing and letting go of what's not mine. And for me, it's doing my contemplations every day and connecting into spirit and source and allowing that to flow through me so that I don't deplete myself in doing my work. And
you show up to your work too, like from a person of experience, or do you show up to your work like good energy? Like, you know what I mean? Like you show up like
I'm
like in a good space. I'm like, oh, okay, yeah, like let's get into this. You feel ready. If that makes sense.
I've done my work, Sabia. I mean, we all still have work to do, and I continue to do my work. So I'm not saying that I'm done in any way. But I've done my work, and I have tried to, be as clear of a vessel as I can to be there for my clients. I offer compassion detachment, whereas I don't get sucked into someone's story, like I can allow them to have their story and I don't get pulled into it. Do you remember you were in one of my lectures at DoulaCon? Oh my God, everybody was in tears. I'm like, you all, like you all are just, you're getting sucked into the story and
Mm-hmm.
figured out how to create that boundary of compassion detachment. And so it's when we are fully present in our pelvic floor and we are down in the bottom of our bowl. A lot of us live on the top of our pelvic bowl, but when we're in the bottom of our bowl, we're not as influenced about what's going on around you. Like, yes, I can still tear up and have emotion for my client on the table, but I'm not getting sucked into it. And so,
Mm-hmm.
as
I'm
per
gonna read that book, the book that you're suggesting. Let me
wild
put that on
feminine.
my list because I too like can make people cry, and I'm like, I feel
Yeah.
so, but like, is that part of letting go that I'm gonna take from this conversation?
Yeah.
But I want to thank you for your time. We're
Yes.
probably gonna have a part two in the future because I'm coming for another session. So,
We'll see what's up
we'll
there.
get
Yeah.
into that.
Yeah.
But I thank you for your work and your time. And of course, we'll link all the things. Do you have how people can reach you?
Thank you. Yes. Oh, do you want me to share right
Hmm.
now? Okay.
Hmm.
So centerforbirthhealing.com, or is for the clinical practice. If you wanted to do a Zoom session, I can help you work with any traumas or energetic holdings that you might have, see what what's going on in your pelvic space. Centerforbirthhealing.com is for the clinical side of my practice. And then instituteforbirthhealing.com is my educational platform for body workers and birth professionals. They can check out what I'm doing over there. And then I'm on all the social medias as well.
Thank you.
Thank
I
you,
will
Cynthia,
see
for
you
all
in a
you do.
couple
Yeah,
months.
I am so excited for that. Thank you so